And we're here once again to talk about COVID. And we have El Señor Marcos Mejia from the county of Sonoma. And Señor Mejia, welcome to the show one more time. We've been talking for, what is it, almost a year, maybe?
Maybe there.
Yeah, and then your colleagues used to come over before, but you're always bringing us new information, and it's exciting to see, when there's new numbers that you're reporting as far as the number of people who are getting vaccinated. It's really challenging when we hear the number of people who are getting infected. What numbers do you have for us today?
Well, I'll tell you all of that. I just want to start by saying that the Omicron variant continues to spread. And because of that, our focus is on booster shots that have proven to be a great protection against this variant, along with testing the vaccines and encouraging everyone to wear a high quality mask. The boosters provide protections against the worst outcomes of COVID, which is severe illness, hospitalizations, and death. Breakthrough cases in vaccinated people tend to be mild or asymptomatic. What we have seen on vaccinated people are at far greater risk. According to our local data, that shows that individuals who are unvaccinated are 16.4 times more likely to be in the hospital if they get COVID. And unfortunately, there are 13.6 times more likely to die from COVID. And children between the ages of 5 and 7 can only receive the Pfizer vaccine. Children's age 12 and older are eligible for a booster shot of the Pfizer vaccine. Federal regulations have shortened by a month the amount of time that adults and adolescents should wait between second and third doses, allowing them to now seek boosters 5 months after their second injection. As of today, more than 959,000 doses of COVID vaccines have been administered to Sonoma County residents. 78.7% of the eligible population 5 and older are fully vaccinated, and additionally, 8% of this eligible population has at least one dose. Regarding boosters, 59% of the eligible population have received a booster now. The local case rates and COVID-related hospitalizations remain at some of the highest levels during the pandemic. We are still averaging 1,000 new cases per day, which is starting to decrease from the 1,200 that we had last week. And the COVID-related hospitalizations were 106 this week, with 15 of those patients in the ICU beds. The unvaccinated still account for most of the hospitalizations here in the county, especially in our intensive care units. Deaths are increasing primarily among the elderly. Sadly, we have to add 5 more deaths today to the number. So we were at 432 now. We are adding 4 more deaths, so it's 437 now. And most of these people is older people, over 65 years old. And that's something regrettable. We know that Omicron is milder than Delta. And we also know that Omicron is infecting vaccinated people. So most of these older people was vaccinated, but because of their age, their systems are weaker, and they tend to be more impacted, along with the immunocompromised people. That's why the insistence to use the mask for all of us that are relatively healthy, or younger people who's even healthier than me, wear a mask, because that's the way to protect yourself, protect those you love, and protect the community. We don't know what is the health status of the persons around us when we are in public. So we don't want to cause any harm to anyone who could be severely harmed. Even if you don't get harmed, someone else could. So please wear your mask. We also know that 50% of the recent cases are a direct result of gatherings, which is nearly all the gatherings involving more than 12 persons, according to the data. So this public health evidence, along with our local hospitals being at risk of being overwhelmed, prompted 2 recent mitigation steps by the county's health officer, Dr. Sundari Mays. On January 10, Dr. Sundari Mays appealed to residents to stay home as much as possible for the next 30 days and limit interactions with those outside of their immediate household. Dr. Mays recommends that residents limit travel outside the home or just going to work or to school or making only necessary trips such as going to the grocery store or the doctor. I have mentioned this before, the last week and probably since as soon as the order came out, but since the numbers are still high, they are decreasing already. But today we have 887 and we're averaging 1,000 cases. That's still high spread of the virus across everywhere we go. So we have to be watchful and wear our mask and keep our distance. She also issued a health order canceling large gatherings to slow the spread of the virus. By large gatherings, we mean more than 50 people indoor or more than 100 persons out in outdoors where social distancing is not feasible. These gatherings are prohibited for the duration of the order. The order will remain in effect until February 11. The order will reduce the likelihood that many individuals will be exposed to COVID-19 at a single event. Those, in other words, we know them also as COVID spreader events, right? And will help slow the spread that way. The county will expand access to pediatric and adult COVID-19 vaccines and boosters through a series of large-scale weekend clinics at the Sonoma County Fairgrounds. Up to 500 vaccines can be administered per day at these clinics, which will be held in the Garrett building at the fairgrounds. Clinics will be held on Saturdays and Sundays for each of the next 4 weekends, specifically this coming weekend on January 29th and 30th, and later in February on the weekends of February 5 and 6, 12 and 13, and 19 and 20th. The clinics will be open from 9 a.m. to 4 p.m. Now, regarding schools, the situation has not improved. There has been 1,347 students that have reported positive since the schools reopened back in August, and additionally, 171 staff has resulted also infected with COVID. So we estimate that there are much more cases than that because not all the cases are being reported. And several schools closed for a few days because of the high case rates. Unvaccinated children from between 5 and 17 years old are being infected at 5 times the rate of fully vaccinated children. School-age children account still for 20% of the new cases in the county, more than any other age group right now. This has been consistent through this surge with Omicron, that the kids have been the most infected with Omicron, with 20% of the groups. Now, some positive news, on the other hand, is that more than 44% of these children between 5 and 11 have received at least 1 dose since the vaccine began to be available back in November, and 28% of this group are fully vaccinated now. A list of school-based clinics is on the Sonoma County Office of Education website, along with information for parents. For a full list of clinics, please visit scoe.org, that is scoe.org. Another good news is that the first wave of 400 million free high filtration masks, or the N95s, as we know them, provided by the Biden administration, have been shipped to participate in pharmacies and community health centers. Most major chains, such as Rite Aid, Walgreens, and CVS, will have them, along with many community centers. No documentation of any kind is required to pick up this mask. Providers are handing out 3 N95 masks per day per person. The Biden administration has said there is an ample supply, and the program is meant to endure broad access. More than 1 person from the same household can get them. Also, with testing, we are testing in average 6,000 persons. That total doesn't include all the at-home rapid tests being used. As demand surges for testing, both the PCR, the molecular test, and the rapid test or the antigen test, the County Department of Health Services continue to work with our testing partners to make more testing available. Every home in the United States is eligible to order 4 free at-home COVID tests. This is they can order per household. The tests are completely free, and orders are usually taking between 7 and 12 days. So it's better if you order soon so you can have them on time when you need them. Please go to this website. It's called covidtest.gov. And if you take one of these at-home antigen or rapid tests, we urge you to report results by visiting socoemergency.org/test and complete the form under the section if you test positive with COVID at a home test, or you can call us at the hotline at 707-565-4667. And we remind you that for more information about vaccines, testings, and resources for those impacted by COVID, please visit socoemergency.org or call us to 707-565-4667. And that's our update for this week.
Thank you, as always, for taking the time and coming over. Just a reminder for people or for individuals who may be having difficulty ordering your at-home tests because of the internet not working or you're just not comfortable with technology, please feel free to call 1-800-232-0233. That is 1-800-232-0233, which is a phone number established specifically for people who are having a hard time ordering their tests online and or who, again, have difficulty in general with technology. 1-800-232-0233. And with that, I want to thank you, as always, for taking the time, Señor Mejia, and being with us here on KBBF and our show, Líderes del Futuro.
Thank you for having me, Rafael. I hope that next week I continue to tell you that the trend with Omicron continues downwardly. And we see those cases descending, but especially hospitalizations. There's a lot of people in the hospital right now. So I hope that continues to decrease, and I hope that also protects our elderly and our immunocompromised people who's been severely affected. Thank you for having me, and have a nice weekend, and I'll see you next week.
Take care.